Welcome back to Abe Northwest. Are your toes ready for sandal season? Here to share a quick, painless, revolutionary treatment for unsightly toenail fungus. Please welcome back from Oregon Derma Center, Dr. Jason Black. Good to see you again.
Yeah, glad to be back.
How common is this toenail fungus that you're talking about?
1 in 10 people have some form of toenail fungus. It could just be a little bit. You notice your toenails can start raising a little bit, and some people just think that the health of their toenail is just not the way it should be. And but a lot of times that fungus starts traveling underneath the toenail, and it can be growing for years, and then it just gets worse and worse and worse.
Is it painful? It's unsightly for sure.
It's not necessarily painful, but like if the toenail starts to thicken and you can get the toenail growing incorrectly, that becomes painful.
Right.
So the result of it becomes painful.
So what's the treatment you have?
So the treatment I use is a laser, so photon laser. So I've talked about this on previous segments, and a lot of people have started calling in because I'd mentioned I treat toenail fungus. So
right.
it's a erbium YAG laser that we use, and so it's just 4 treatments. We prep the toe, maybe file it down, and then it's just doing some passes of light that we actually just treat the toenail fungus. So a lot of times, like when we do it, you'll actually see a little sparking where you actually you're getting rid of it. So as we do the treatments, less sparking, and you get a healthier toenail that ends up growing out of it. So
how long has this treatment been around?
Well, the laser's been around for over 60 years. The treatment is probably the last 5 years, I would say, that it's been used.
And a lot of people, you were saying, they feel pretty insecure when they have this fungus. They don't want to wear open-toed shoes or sandals.
I think when we think of aesthetics, we're always thinking about our face, right?
Right.
But I think that feet are something that are going to be uncovered, and people who want to wear flip-flops or sandals or Birkenstocks, or we're getting in the summer months, and it definitely has an impact on how people feel, even if they're going to the gym. I mean, if you have a lot of fungus on your toes, I think people feel insecure about it. Patients, will tell me that.
So you said 4 treatments is all you need?
4 treatments is commonly all you need. So you do it once a week. You come in. It takes about 10 minutes. It's very cost effective. A lot of the medications that you take for fungus are actually really hard on your liver. So it's a very, very cost effective, efficient way to get rid of it.
And how long before it's completely gone?
Well, you have to wait for the toenail to kind of grow out. So, and that every person's a little bit different. So depending on your health, so some people's toenails can kind of grow out in a few months. Some people in a month. It just kind of really depends on the health of your nails and how fast your toenails grow.
And then do you get treatments to maintain it?
Nope. So I think when we talk about fungus and we're talking about treating toenail fungus,
right.
Big thing that we're in contact with that all the time. So you want to keep your body healthy, and you want to do some things that actually naturally can prevent it from the inside out, as well as treating on the outside. So once you cure it, it's gone.
How do you avoid getting it in the first place?
I think that's kind of the golden answer. I don't know. I think we just we don't know the answer to it. I think people, people talk about going to the gym and moist environments, and I mean, there's definitely, you can come in contact with it, but I think certain aspects of people's immune system get depressed, like if they're under stress, or maybe nutritionally, maybe they're not doing the right things that they need to do for their body, and it makes them more susceptible to where the fungus can then live. Just like yeast. Yeast is the same type of thing. Like some people have candida, and why one person would get it over another, a lot of it has to do with internal environment.
Does it spread to both feet usually?
Not always. It can. I'm treating a young boy who's 16, and he has it on every finger of his right hand, but not the left. Yeah, and there's no, first time I've ever seen that, and he's had 2 treatments, and it's pretty much all gone. It's getting new nails, and he's tried everything. So I don't know why it hasn't spread anywhere else.
That is wild. And you said the 4 treatments. We want to make sure that people know that if they'd like to find out more about it, about the laser treatment, you can contact the Oregon Derma Center, 503-616-7936. We'll put the information on our website as well. Thank you very much.
Thank you.
Good to see you again.
Yeah, absolutely.
All right.